Fertility clinic in Toronto is the first in North America to offer a new and somewhat controversial fertility treatment for women called Augment. The technique rejuvenates a woman's mature eggs, and Dr. Robert Casper is with the Toronto Centre for Advanced Reproductive Technology, and he joins us now. Good morning.
Good morning. Thanks for inviting me.
Who specifically are you treating, and how do you, is this for women who have passed their sort of prime fertility time?
Yeah, so one of the things that's happening right now is women are waiting longer to get pregnant. So my mother's generation, for example, had their first baby around the age of 25, right at their peak of fertility. And in the last 10 years or so, women are now trying to get pregnant for about the first time at age 36 or so. And by the time they have trouble or realize they're having trouble, we're seeing women around 39 or 40 coming to see us. And one of the problems is that all the eggs a woman has are in their ovaries when they're born. So a good analogy is thinking of a flashlight sitting on a shelf in a closet for 39 years. The flashlight itself is okay, but the batteries start to run down over time. And that's exactly what happens to eggs. And this new procedure called Augment is designed to try to sort of replace the batteries in the eggs and increase the energy production.
How does it work exactly?
So there was a discovery a few years ago of oocyte precursor cells or stem cells in the surface of the ovary. So what's involved is actually taking a little piece of the ovarian surface, finding these oocyte stem cells, and the mitochondria, which are sort of the batteries of our cells, in these stem cells are exactly the same as the egg mitochondria. So the idea is to inject these mitochondria into the eggs at the time of fertilization.
Any success so far?
Yeah, we've had a number of pregnancies, so it's looking very promising, actually.
Of women, how old?
All of the women so far have been under 40. So we're the next phase is to try to look at older women as well.
Why is this this kind of medicine so unregulated? Because, you know, in other areas, things are tested, and you can often go through over a decade of research. And when it comes to fertility, it can be very divisive, and obviously people get very emotional over it, as they should. But it's very unregulated. And this is new science that hasn't necessarily been tested, but is out there, you said, for private consumption.
Yes, so it's not really unregulated. And to be fair to this procedure, at least, something really similar was done about 15 years ago in women, where mitochondria or cytoplasm, the fluid around the nucleus of a donor egg, was injected into the eggs of women who are having the same sort of problems that I'm talking about. And there were about 34 or 35 babies born with no problems back then. But the issue there was they used a donor egg, which resulted in changing the genetic makeup of the baby. So the advantage of this procedure is that we're using the woman's own eggs, or egg stem cells, to get the mitochondria. So it's her own mitochondria that we're injecting into these eggs, so there's no change in the genetic makeup of the baby. So it should be safe from that point of view. The other issue is that there really are no good animal models for human infertility. Most rodents, for example, don't even have a menstrual cycle. They have an estrous cycle that only lasts 4 days. So it's really difficult to test some of these things in animals.
Some experts are saying that there's not enough data. You're the only North American clinic to offer this procedure. That there's not enough data to go on to determine whether there are risks to the mother or to the child.
Mm-hmm. Well, as I said, this procedure has been done already 15 years ago, so it's not brand new from that point of view. Those babies seem to be fine. And the only reason the procedure was banned then is because of this change in the genome. So the regulations in Canada right now really, according to the Reproductive Technologies Act, are that you can't change the genome, you can't clone a human, and you can't buy or sell eggs or sperm. So there are some specific regulations in Canada relating to fertility.
When we think of medical intervention, I think a lot of people think of it as something that fixes something that is broken. You are ill, and you go to a doctor, and they treat that and make you better.
Right.
But if your body has gone through the natural process of producing eggs, and now the very natural process of starting to shut that down, is there an ethical concern behind intervening?
Well, you know, that's a really good point. And what we should be talking about is not Augment today, but we should be talking about getting the information out to women that they shouldn't be waiting till they're 39 to try to get pregnant. If they're 34, 35 and they haven't really decided that they want to get pregnant yet, there are a lot of excellent egg freezing technology available now. So we can actually store eggs from women who maybe don't have a partner yet or want to finish their career before they try to have a baby.
Right.
And these frozen eggs now work the same as fresh, so the pregnancy rates are exactly the same. So I think it's a...
What does it cost? Really, I know this is a study, but what does it cost for, like IVF can cost about $15,000 for a cycle. What could this cost? Because I'm sure a lot of viewers are interested.
Sorry, you mean for the mitochondrial injection
procedure? Yeah, for the Augment.
IVF costs about, or IVF with injection of a sperm into the egg is called ICSI, or intracytoplasmic sperm injection. It costs about $8,000. The fertility drugs would be about $2,000 or $3,000, and then this procedure is going to add $25,000 to that. So the company has set the price right now, and unfortunately there's nothing we can do about that, but it is a very high-tech procedure.
Well, thank you so much, Dr. Robert Casper, for coming in and talking to us this morning.
My pleasure. Thanks very much.
Fascinating.